Today's podcast is on development and parenting. The basics of development. Nature versus nurture comes into play in this unit as well. Development is influenced by both nature, heredity, and nurture, the environment. Each individual inherits a specific pattern of genes from their parents. The expression of those genes is influenced by the environment that they grow up in. Both nature and nurture work together in influencing changes throughout life. Three big terms to know are lifespan, life expectancy, and life course. Lifespan is the biological limit to someone's life's length. Life expectancy is the average length of time that a given age-based cohort is expected to live. So age-based cohort is a group of people that are about the same age, maybe the same generation, that have lived through the same main life events, same health care, things like that. Life course, this is the term used by sociologists to refer to the normal expected set of events that take place over an individual's life. Keep in mind that this is determined by societal norms, so what society says is correct. So some people may get distraught if their life course isn't what they thought society said it should be. Maybe they decided not to go to college, or they didn't buy a house, or they didn't get married. And sometimes the expectations of a life course can cause people undue stress. Development research. All research on development is quasi-experimental. Most of the time, age or gender are the variables. So these cannot be truly manipulated, but experiments can be designed to test whether different conditions affect different age groups. Research on aging can also be tricky because of selection biases. So people that live to an old age may have engaged in low-risk behaviors or taken really good care of their health. On the contrast, people who engage in more high-risk behaviors may not live as long, so they wouldn't be able to be a part of research on aging. Prenatal development and genetics. There are 3 stages in the development of a human. We can remember them by the acronym ZEPH. Zygote is up until 2 weeks, so from conception to 2 weeks. Embryo is from 2 weeks to 2 months, and then the baby becomes a fetus until birth. Some genetic factors in development. One is called phenylketonuria, or PKU. This is when the enzyme responsible for processing the amino acid phenylalanine is absent. And so if phenylalanine accumulates in the body, it can cause damage to brain tissue. And this condition is detected during the first few days of life. Someone that has PKU wouldn't be able to drink artificial sweeteners like aspartame. If you actually look at the side of a can of Diet Pop or something, it will say a warning for people that have PKU. Sickle cell anemia, or SCA, is the most common inherited blood disorder in the United States. The symptoms would be episodes of pain, chronic anemia, and severe infections. Carriers of sickle cell anemia are resistant to malaria and do not show symptoms of SCA. So if someone's a carrier, that would allow this gene to persist in a population because there's a beneficial component to carrying the gene. There's no cure, but symptoms and complications can be treated. Another genetic factor is Tay-Sachs disease, or TSD. It's caused by the absence of a vital enzyme, HEX-A. This enzyme prevents fatty substances, lipids, from accumulating in the brain. If they do accumulate, it can lead to brain damage. The destructive process begins early into pregnancy, but unfortunately, symptoms do not appear until a child is about 6 months old. By about 2 years of age, most children have seizures and reduced mental function. Eventually, children become blind, paralyzed, and non-responsive to their environment. Most children that are diagnosed with Tay-Sachs do not live past the age of 5. Down syndrome. This is a chromosomal disorder. It's caused by an error in cell division. It can cause delayed development, short stature, and mental deficiencies. A teratogen is something that happens to the mother's environment while she is pregnant, and it can affect the embryo. So, examples of this would be certain chemicals, medications, taking drugs or alcohol, smoking, as well as different infections that happen. An environmental factor or teratogen is something called rubella. Many times people are vaccinated for rubella now with the MMR vaccine, the mumps, measles, and rubella vaccine. 25% of babies whose mother contracts rubella during the first trimester, so the first 12 weeks of pregnancy, are born with one or more birth defects. Eye defects, so that might cause vision loss or blindness, heart defects, and sometimes cerebral palsy. The infection can frequently cause miscarriage and stillbirth, and not all babies in this situation are affected, but they must be closely monitored throughout life. Another environmental factor that can affect fetal development is fetal alcohol syndrome. This is when the mother consumes alcohol during pregnancy, and it can cause significant mental impairments. Parenting styles. There are three big types of parenting styles: authoritarian, permissive, and authoritative. Authoritarian, I remember this by thinking of a totalitarian government. This is where parents impose rules and obedience. It's very much top down. Permissive says that parents submit or they're submissive to children's demands. The children run the show. Authoritative says parents are demanding, but they're still responsive to children and their needs. It's very much a give and take.